Let's cross to the other side of the country now and catch up with Andrew Miller, Dr Andrew Miller, who's the head of the Australian Medical Association in Western Australia. Thanks for joining us, Andrew. Appreciate your time.
Great to be with you.
Tell us first up your thoughts as an organisation about the level of coordination between the states, the level of communication with medical practitioners on the ground. Are we well prepared now, given we've really had a lot of warning with pretty slow progress with the coronavirus on Australian shores?
Well, it's not surprising, is it, Chris? No one ever thinks, I need something done quickly and efficiently. Let's call all of the branches of government and get them to do it for us. They're not renowned for their ability to deliver big solutions really quickly to the front line. So we will work with government. Doctors on the front line are jumpy about some of the things that have happened over the last couple of weeks, but we're looking forward because we know that we need to be concentrating now on the phase of containment to try and slow this thing down. We can handle it as a nation if we work together, slow the thing down, but we need the politicians to step back from giving any medical advice or from criticising any doctors in particular, and we need them to just give us what we ask for and get out the way.
There's been conflicting advice about what doctors are doing. Some have signs up at the front saying if you want a coronavirus check, then ring a number and don't come into the surgery. Others are more relaxed about it. Others referred to special centres and then uncomfortable about queuing up for long periods of time. What's the ideal solution to people who have concerns and want to get a check?
Well, the ideal solution is for the government to do more of what they did today. They announced the telehealth item, which is a good start. That allows the GP to get on the blower to you and talk to you about your symptoms and refer you for a test without you going to a waiting room. How sensible is that? We should have had it weeks ago. But it shouldn't just be for that, for people who suspect they've got COVID, because we've got lots of business as usual that needs to happen. Really, we're going to get to a phase where we're all busy, a few of the doctors are sick. It should be telehealth for everything, for everybody, to keep business as usual going. And the other thing they need to do pronto, not talk about it for a few weeks, is establish dedicated healthcare working high-speed turnaround testing, so that if your doctor, your nurse, your hospital staff got a bit of a sniffle, they get a test straight away on the spot. Yes, you can go to work. No, you can't. So that's because this healthcare workforce is going to be in real short supply soon. Yeah,
they are the front line. They're the heroes we're all going to be relying on in coming months. Are you saying they should have a prioritised testing mechanism for healthcare workers?
Well, of course they should, and they must, and it's got to be done and implemented really quickly. So, whilst we're happy that there's been some progress today, we put money on the table. That's great. The reason some of the GPs won't open the door to people with fever is because they're in there with no protective gear. I mean, that's a suicidal manoeuvre, isn't it, to ask someone into your practice when you've got no protective gear? Because then what you have to do, and by the way, these are small businesses, which your viewers will relate to, you've got to go home for 14 days until you find out whether you've got the disease or not. So the GPs have been doing the right thing. Occasionally they've been getting kicked in the head because even though they've followed the guidelines, they've ended up with the disease. And so the disease we're still learning about, how severe the symptoms are going to be and so on, and it seems like in some cases it'll be quite mild and very difficult for healthcare workers to know whether they've got it. We need rapid testing for them.
Now, what about your advice to patients if they do have concerns? I guess now that we're looking at these tele and video consultations, the advice is to use that in the first instance rather than just turn up in a surgery.
Yeah, well, look, it's still true in Australia at the moment. The problem is this will change quickly over the next few weeks. The countries for you to look at, people who are interested in this, watch Spain, France, Germany. They're about halfway between us and Italy. The Italians aren't silly. They've got an excellent health system in Lombardy in the north there where this has really taken hold. They're about 17 days ahead of us in numbers-wise. We don't think we'll get to where they are in 17 days. God, we hope not. But it's certainly conceivable in a month or two that we'll have that number of cases. So watch the countries in between and see what direction they're going. My advice to patients who, at this stage in the community, it's very unlikely that you've picked it up in the community here. So if you've travelled anywhere overseas and you've got a flu-like illness, then you're going to need to get tested at some point. It's not urgent. If you're not feeling particularly unwell, don't be frustrated by wait lines at a clinic. Don't be frustrated by wait times to get on a hotline, because 80% of people are not going to get real sick. If you do get shortness of breath, if you are getting obviously unwell, then that's the time to think about ringing the emergency department, saying I'm having difficulty breathing and so on. No one will have a problem with you turning up there when you're symptomatic like that. But if you're the walking wounded, if you've got what you see as being a bad cold or a bit of the flu, then you can be patient. If you've been overseas, you need a test. If you haven't at this stage, you don't.
Do you like the idea of these drive-through testing stations that they're running out in South Australia?
Love it. I love all the ideas that people can come up with that keep patients away from doctors. Even better if they don't need to see any clinical staff there at all. It's just the test collection people and they've already done the video consult. So those sort of ideas are brilliant, and the respiratory clinics that the government are rolling out, 100 of them around the country this size is not a lot, but I tell you what, it's a great start, and it's a model to get it out there, get people to used to the idea that there'll be a dedicated space to go. That way, seeing as we've got not much left in the way of personal protective equipment, it seems, in the entire country, in the entire world, in fact, you can just use your protective equipment on the staff in those clinics. Your GP clinics that are not set up for this, they can run business as usual, because let's not forget, our health system was, you know, running on the smell of an oily rag and doing an incredible job before this came along. It wasn't like we had a whole lot of extra capacity sitting around waiting to be used. And that system still needs to keep rolling for people with heart attacks, strokes, cancer, diabetes and kidney disease.
Spot on. Thanks so much for joining us, Andrew. Appreciate it.
Great to talk to you.